If a nursing aide harms a patient in a Connecticut nursing home, there's already a system to track that. Starting in 2027, that system gets much bigger. The law is Public Act 2613, titled An Act Concerning Various Revisions to the Public Health Statutes. Governor Ned Lamont signed it on May 14, 2026. Like some bills we've covered before, this is a large omnibus public health bill, touching dentists, EMS providers, school health clinics, and more. Today we're focused on just one piece, Sections 23, 24, and 27, which rework Connecticut's Nurse Aide Registry. Some background first. Since a 1987 federal law, every state has had to keep a registry of certified nursing assistants, tracking who's trained and who has a substantiated history of abuse or neglect. In Connecticut, that registry has mostly applied to one setting, nursing homes. Starting October 1, 2027, that changes. The registry expands to cover nurses' aides working at any healthcare institution licensed by the Department of Public Health. That means hospitals and other DPH-licensed facilities are now part of the same oversight system that used to apply almost exclusively to nursing homes. The law carves out two groups. If you're already licensed or certified by DPH as a health professional, you're excluded from this specific nurse's aide definition. And if you're a volunteer providing these services without pay, you're excluded too. The law also expands DPH's authority to act. It can now receive, investigate, and prosecute complaints against nurses' aides at any DPH-licensed institution, not just nursing homes. The grounds for a complaint are specific: illegal, incompetent, or negligent conduct while providing nursing-related services. Also, abuse of a resident, patient, or client. Also, neglect of a resident, patient, or client. And misappropriation of a resident, patient, or client's property. If DPH substantiates one of these complaints, it can take real disciplinary action, including authority for summary suspension. Fines for violations can reach up to $25,000. To understand why this matters, it helps to know how someone becomes a certified nursing assistant in Connecticut in the first place. It requires at least 100 hours of training, 75 hours covering nursing care, personal care, and residents' rights, plus 25 specialized hours on managing challenging behaviors. After training, candidates take a competency exam, and once they pass, their name goes on the state's Nurse Aide Registry. That registry serves as a safety check. Employers use it to confirm someone is certified and to see whether they have any substantiated findings against them. Before this law, that safety check mostly stopped at the nursing home door. A nurse's aide working in a hospital setting outside a nursing home was not necessarily captured by the same registry or disciplinary process. This law closes that gap, extending the same oversight to any DPH-licensed institution where these aides work. It's a quieter change than some of the bills we've covered, but it directly affects patient safety across a much wider range of healthcare settings. It also gives families and employers a more complete picture. One registry, one disciplinary process, covering nurses' aides across the healthcare system regardless of where they work. The change does not take effect immediately. Institutions and DPH have until October 1, 2027 to prepare. Connecticut's Nurse Aide Registry and disciplinary system, once limited mostly to nursing homes, now covers any DPH-licensed healthcare institution, starting October 2027. Do you think this kind of oversight should have applied to all healthcare settings all along? Let us know what you think, and if you learned something new, hit like and subscribe for more breakdowns of the laws shaping Connecticut.